The reality is this, Rachel. In Georgia, we beat the national average in every single category that makes this virus so much worse. Our rates of heart disease, obesity, diabetes, asthma are all above the national average. And then you layer on top of that, the African-American community is even above that. And so the fact that we are opening up businesses in this state and that we are putting the economy before the lives of people is it's baffling. And I keep searching for new words, and I can't find any because I am still completely dumbfounded that we were one of the last states to close down and yet one of the first states to open up. And the governor has said this is about the economy. And unfortunately, the people who will be the test case for whether or not we have gotten it right are the people who can least afford to be sick and are more likely to die.
I'll tell you, Madam Mayor, one of the things that I am worried about with Georgia, because it does seem like your governor is ideologically fixed on the idea of not having businesses shut down, of not enforcing stay-at-home orders. As you said, he started so late and he's ending and he's releasing these things so early. I am worried when you look at that alongside the fact that there's so little testing in Georgia. Georgia is one of the worst states in the country in terms of how much testing there is. I'm worried that he's not going to feel any pressure to try to increase testing numbers in Georgia because testing numbers might reveal bad epidemiological consequences of his policy decisions.
So our testing has increased, but it's still dismal. We are still 40th in the nation in testing. And, listen, Rachel, the reality is this. We all bring a different lens to office. So the governor was a small business owner, and I'm certain that's the lens that he brings. Well, what I bring is the daughter of a small business owner, a woman who owned a hair salon. And so I know what happens in a hair salon. There are people from the community who come into the hair salon. Many people in the hair salons don't have health insurance. They are living paycheck to paycheck. And so even if we are testing people in our communities, and this was a question that I posed to the governor and Dr. Toomey, our health leader of our health department in Georgia today, testing is a point-in-time test. And so if I test negative today and then I go out and get exposed tomorrow, it means what? And so we know that testing is just one part of this. There needs to be contact tracing. There needs to be isolation and quarantine. And there's still so much more to be done. And even when you have funeral directors saying, I've never seen anything like this before, and you couple that with the CDC, along with health professionals and even the president of the United States saying it's too soon, then I think all of those are signs that it's not the appropriate thing for us to do at this time.